Assalamualaikum warahmatullahi wabarakatuh. My name is Bishun Aisyah binti Ahmad Farid, and together with my group members, we present about renal EWING sarcoma in CT scan. This is the contents of our presentation, including introduction, sign and symptom, the view, and the conclusion. What is EWING sarcoma? EWING sarcoma is a type of cancer that primarily develops in bones or soft tissue. While it can occur in any bones, EWING sarcoma cells can spread to the other body parts such as bone marrow, lungs, kidney, heart, and other soft tissue. There are four main types of EWING sarcoma categorized based on the tumor's location. First, we have the bone tumor. The majority, 87% of EWING sarcomas, originate in the bone, often in the thigh, pelvis, ribs, or upper hand, although they can develop in any bone. Third, we have the peripheral primitive neuroectodermal tumor. This tumor arises in the nerve and can develop in various parts of the body. And lastly, we have the skin tumor, which is a subtype of PNET located in the chest wall.
Hi, my name is Nur Ali Nabila, and I'm going to continue this presentation regarding the signs and symptoms of EWING sarcoma. So, firstly, the most common symptom is the persistent pain in the affected area. This pain is often localized to a specific region, such as the arm, legs, or ribs, and it may intensify during physical activities or at night, which will disrupt the sleep. Next is a palpable lump or mass that usually found on the ribs, arms, or leg. Bone fracture is also the symptom for this disease. The tumor will weaken the affected bone, making it more prone to the fractures. And next is a fever. Fever without an obvious cause or low-grade fever that persists and cannot be linked to infection is also a common symptoms for this disease. Next is a weight loss and poor appetite. This cancer can lead to a significant weight loss due to the decreased appetite and metabolic changes. And lastly is a nerve compression symptom, which is numbness or tingling. The tumor near the spines or nerve may press on them that will lead to a numbness or tingling in the arms or legs.
Assalamualaikum, I'm Alia Maisara. So now let's dive into how renal EWING sarcoma looks on CT images. Firstly, this is axial CT image which shows a massive solid cystic mass measuring 164 by 143 by 108 mm originating from the left kidney with heterogeneous enhancement as indicated by the red arrow. Solid regions represent viable active tumor tissue, while cystic regions indicate areas of necrosis, hemorrhage, or fluid accumulation commonly seen in aggressive malignancies. Brighter enhancing areas suggest viable tumor tissue, whereas darker, non-enhancing areas correspond to necrotic or cystic components. Next, loss of clear fat planes surrounding the kidney indicates local invasion into the perirenal fat and possibly gerotas fascia, the kidney's fibrous covering. So, this breach can be a key feature of aggressive tumors. Then, the renal pelvis and collecting system may be compressed or obstructed, resulting in impaired urine drainage and kidney function loss. So, this mass is large enough to compress and displace retroperitoneal structures such as spleen, pancreas, bowel loops, and major vessel.
Assalamualaikum, my name is Siti Nur Alia Afika. So I will continue for the axial slice. Okay, so the axial image shows a large tumor in the left upper abdomen. It crosses the midline, extending beyond the left kidney. And then the tumor is pushing the nearby structures, including the small bowel loops, which are compressed and shifted. And it also affects other retroperitoneal organs such as the spleen and the pancreas. Okay, next is there is no lymph adenopathy. There is no evidence of lymph adenopathy where there is no enlarged lymph nodes in the retroperitoneum or the nearby areas. This is important because lymph node involvement is often seen in advanced cancers, and the absence of swollen lymph nodes suggests that the tumor has not spread to the lymphatic system. Okay, and then lastly, as there is no renal vein or IVC thrombosis, where the renal vein and the inferior vena cava or IVC are clear with no sign of tumor spreading into these vessels. This is significant because many aggressive tumors such as EWING sarcoma, renal EWING sarcoma often invade these blood vessels. So the clear vessels in this image reduce the likelihood of vascular invasion, which is a positive sign of this case.
Hi, I am Farha.
I will continue the presentation by presenting the appearance of the pathology on a coronal view of CT abdomen pelvis. Based on this CT image, we can see that there are a few structures such as the stomach, pancreatic body, spleen, liver, infravena cava, and so on. We can see that there is a green arrow there that shows a huge retroperitoneal heterogeneously enhancing solid cystic mass that is originating from the left kidney. So the upper limit of the tumor is at the level of pancreatic body. Meanwhile, the lower limit of the tumor seen at the mid part of the left kidney. And the tumor mostly grows anteriorly with exophytic pattern. Exophytic pattern means the tumor grows outward of the renal surface.
Hi, my name is Adiba and I will continue the presentation with the sagittal view. This ECT image shows a sagittal reconstruction of the abdomen and pelvis. Based on the sagittal view, we can see some structures such as the stomach, lumbar, spleen, kidney, rectum, pelvic bone, profunda femoris artery, deep circumflex artery, rectus abdominis, small intestine, cervical fat, and also the lung. The two white arrows here appearing to point to a very large, rounded, and also hyperhidrotic lesion or a mass as it is darker relative to the surrounding tissues. This well-defined mass appears to extend into the surrounding tissue, which is the renal. This is typically suggests that the mass may have cystic or also necrotic component, which is commonly observed in aggressive tumor like Ewing sarcoma. As we can see here, the upper limit of tumor is at the level of pancreatic body, while the lower limit of tumor is at the level of mid part of the left kidney. And lastly, the tumor mostly grows anteriorly with the esophageal pattern.
Assalamualaikum, I'm Saydatul. For the conclusion, renal EWING sarcoma is a rare and aggressive tumor. CT imaging in sagittal, coronal, and axial planes is used to assess the tumor, evaluating local invasion, and identify distant metastasis. On CT, it usually appears as a large heterogeneous mass with areas of necrosis, hemorrhage, and variable enhancement. The sensitivity and specificity of CT scans for diagnosing renal EWING sarcoma are not consistently reported, but studies highlight differences compared to other image methods. In a study comparing different image modalities between PET-CT and CT scan, PET-CT showed a sensitivity of 100% and specificity of 96%, and the study suggests that CT may be less sensitivity and specificity than PET-CT. The sensitivity of CT scans for diagnosing renal EWING sarcoma is generally considered low due to the overlapping imaging features with other renal tumors. For the specificity, certain features like septum-like enhancement may help differentiate renal sarcoma from other tumors, but they are not definitive and lack clear specificity values. That's all from us. Thank you.